Hello, I am Dr. Kim. Today, I have prepared a video in response to a question that was previously asked on our channel. The question was, I want to know how the outcome of scarring during subbrow lift surgery varies depending on age and gender. Today, I will discuss the scarring outcomes of the surgery, analyzing the effects based on age, gender, body type, and a case-by-case review, while comparing before and after photos. The first picture I will show you is the scar after 1 week. Many patients are curious to see what the scar looks like a week after their stitches are removed, as it's common for them to return to work right after surgery. As shown in the photo, the scar is not very visible after the stitches have been removed. When only undergoing eyebrow lift surgery, there tends to be relatively less bruising and swelling. Of course, due to individual differences, even if there is more bruising, it may only require covering with makeup, so you shouldn't worry too much. If you undergo multiple surgeries simultaneously with a subbrow lift, such as buried double eyelid plasty or fat grafting, you may experience slightly more bruising. However, that should subside within a week or so I would not worry too much about it either. The body undergoes a phase where it produces a significant amount of scar tissue to aid in wound healing firmly. Following the removal of the stitches in the first week, the scar will begin to stretch during the second week. This continues to happen for approximately 2 to 3 months. During the period of increased scarring, the wound feels tight, pulling, itching, and may experience stabbing sensations. It may appear red, bumpy, and bulging. At my clinic, we usually discuss the scar during the 1-month follow-up appointment. These are normal wound reactions that your body experiences throughout the healing process, so you shouldn't worry too much. When you reach the final state, all these symptoms will subside. I've covered the wound closure process in detail in previous videos, so if you're curious, feel free to check them out. Let's look at a patient's case by gender and age. This is a 40-year-old female patient. There is some bruising after the stitches were removed, but it's not too severe. In the final stage, the scar is nearly invisible. Of course, it won't disappear entirely due to the surgery, but as you can see in the picture, once it becomes blurred, the scar is no longer a problem. When performing a subbrow lift, it's essential to lift the medial side of the brow, since this area is anatomically less favorable for scar reduction. However, with skilled suturing, you can achieve excellent results as seen in the picture. Here's a 50-year-old female patient with minimal bruising and swelling a week after surgery. The scar is not very noticeable either. The scar will fade to the point of being nearly invisible when it reaches its final state, which usually takes at least 6 months to achieve. It'll take up to 2 years for the scar to continue improving, so please be patient and give it time to heal. In this case, once more, I ensured to lift the medial side of the eyebrow. If you examine the final result, you'll notice that the scar is not very noticeable on either the lateral side and the medial side of the eyebrow. This is a female patient in her 60s. Upon examining the 1-month results, you can see that she has some redness and bumpiness. This is particularly pronounced on the medial side of the eyebrow for anatomical reasons. However, over time, by the time you reach the final state, it has all faded, and the scar is almost invisible. If you have a scar for a month or 2 and it appears red, don't worry too much about it. Our next patient is a man in his 60s. Men often have a tougher time with scarring since they tend to lack tattooed eyebrows and don't frequently wear eyebrow makeup. With careful surgery, we can achieve a nearly invisible scar, as shown in the photo. Just because they are men doesn't mean that scars are a problem. As you have seen in many of the cases I have described, the results are ideal for droopy eyes, regardless of age or gender. As long as the surgery is performed correctly, the scar is not a significant concern. When designing a subbrow lift, the more loose skin there is, the more skin needs to be removed. The length of the incision will also increase, which is why the incision line is often extended to the medial side of the brow, as shown in the photo. Anatomically, the front of the brow is somewhat less favorable for scarring reduction. Therefore, you should exercise greater caution when operating in this area. As long as you take care and do a good job, scarring isn't a significant concern for the medial side of the brow. In many hospitals, the medial side of the eyebrow is more prone to scarring, so they focus on the lateral side. In that case, you might end up with oblique wrinkles, or you may develop a fierce look, as it only extends up behind the eyes. In all the cases I have presented, I have caused sufficient lifting on the medial side of the brow. As you can see in the pictures, scarring is not a significant issue. He's a young man in his 20s. Younger men typically have thicker skin and are more prone to scarring, which disadvantages them in terms of scar treatment and reduction. However, even in these patients, if the surgery is performed with great care and the final result is achieved over time, the scar will fade significantly and become less noticeable, as shown in the photo. Therefore, I don't think you should worry too much if you are a young man in his 20s. This is a female patient in her 20s. We've performed an evenly distributed subbrow lift from the lateral to the medial aspect. A female patient in her 20s tends to have thicker skin and more scarring due to her youth. With the specialized suture method and expert care at plastic surgery, even younger patients can achieve outstanding results in both the medial and lateral sides of the eyebrows, as shown in the photo. Here is a case of subbrow lift surgery on a patient without eyebrows. In some hospitals, there is a misleading explanation that the scar from subbrow lift surgery should be concealed by the eyebrows. However, if you don't have eyebrows, you can't cover the scar, which could lead to visibility issues. As you can see in the photo, even if you can't cover the scar because you don't have eyebrows, if you suture it well and take good care of it, the scar will fade to the point where you won't need to cover it with your makeup eyebrows. Additionally, some hospitals suggest covering the scar with a tattoo after surgery. As you can see, it is essential to perform surgery so that you don't need a tattoo. And I think that making the scar look like it is and getting another tattoo to cover it up is like giving a disease and giving medicine. The last case involves a patient with a keloid. It's rare in Korea, but in my practice, I meet patients with true keloids. Even with such an unusual constitution, if you perform the surgery correctly and manage it well, you can achieve similar good scar results as the general population, as shown in the photo. Of course, in the case of a patient with such an unusual constitution, more detailed surgery is required. Don't give up prematurely, because you can achieve good results with proper surgery, even with such an unusual constitution. You should consult with a plastic surgeon who has extensive experience in this field. By examining the cases based on gender, age, situation, and body type, you can gain some insight into the scars that result from surgery. As our hospital is recognized as a specialized center for subbrow lifting surgery, we frequently receive inquiries about revision surgeries when patients are dissatisfied with the outcomes of procedures performed in other hospitals. Unlike the case I showed you earlier, I often encounter instances where the scarring is severe or the surgical design is incorrect, leading to a drastic change in the shape of the eye. I'll discuss this further next time regarding a poorly performed subbrow lift surgery. I hope you enjoyed today's video. If you have any questions, please don't hesitate to ask them in the comment section below, and I'll see you next time. Thank you very much.